Hi, I'm Miguel Dela Cruz. My pronouns are he, him, and I'm a general physician from the Philippines. This is actually my first time to be in such huge assembly. So I resonate with the representative from the youth earlier. It's very, I feel nervous right in front of you. That I have to acknowledge. But allow me to start off my topic. So in terms of transgender health, I would like to share with you my path or the journey that I had to take for me to provide a gender affirmative care. I'd like to set the expectations already that this will not be a lecture. I'm not good at giving lectures. What I'm good at is by sharing insights. So I share stories. This is what I usually experience as well with transgender health, no? When I encounter clients who comes in, whether that's for hormone therapy or other services. I would also like to acknowledge the organizers for this conference. I wouldn't be here if it weren't for them, literally. Okay? And all stories that I'll be sharing are of personal and from my clients directly. Okay? So my agenda is basically to share with you my journey, highlight the smallest of things. You'd be noticing some details that are, oh, that's like petty, no? For a medical provider. That doesn't mean a lot to me. But for our clients, the community, it speaks volumes. No? And at the end of this session, at the end of the day, at the end of this 3-day conference, I hope we all get to reflect on all the information, the insights that we've learned, and see how it will affect or impact our practice, may that be as a clinician or as a researcher. Okay. So I started off in gender affirmative care as a volunteer for Love Yourself, a community-based organization in the Philippines. That was way back in 2016. I started as a volunteer counselor. Eventually, we have internal trainings as a life coach. Life coaching is basically like a case manager. Okay? And then I got to be introduced to different organizations, to the transgender community, and I was given the opportunity to join specific trainings. The only training that I had was a gender sensitivity workshop way back in 2017. So I basically mashed up everything, things I've learned through HIV counseling and the gender sensitivity workshop. This is my thought process. Basically, it's like painting. You mix paints and then you just throw it off the wall and see how it goes. So in Love Yourself, we champion for our clients to have this specific experience. Because in medical consultations, our clients, our patients, tend to forget our medical advices. That's why we issue prescription, right? For them to remember or for them to be guided what meds to take and what are their next steps in terms of follow-up. So we issue them written documents. But what they will remember, for sure, is their experience, how they felt during that 15-minute teleconsultation or within that 2-hour counseling session. So in Love Yourself, or in every client interaction that I have, I make sure that they feel the I experience. Iniingatan, inaalagaan, at inaasikaso. By that, we mean, iniingatan, we make them feel secured and safe. Inaalagaan, we are able to provide care that they seek. And by inaasikaso, we provide other services that they may need, even though they have not yet perceived that, or we offer them certain referrals if the services are not within our means. So as I go through my talk, as I share my stories, I'll always keep going back to this tree. Okay. So when we talk about gender affirmative care, these are the key concepts that I find imperative that you must be knowledgeable of, or at least have an idea of, especially for those who would be venturing into gender affirmative care or would like to incorporate this in their current practice. So definitely you have to have knowledge about SOGSC, This one, I don't like using the gender bread anymore or the gender unicorn. People are not pastries, no? And I don't like the idea that transgender people are seen as mystical creatures like a unicorn. So I appreciate the Center for Women and Gender Studies by University of the Philippines for coming up with this infographic. No, it's easier to relate to. Aside from that, it's good or it's nice to know to have a background on the history of transgender health. Transgender health is not something new. So it has already been in practice way back in the early 1900s. Okay? But it's also nice to know how the medical community perceived gender incongruence, how it started as a form of a sexual deviation, an aberrancy, an abnormality, eventually turning it into a disorder. So basically how gender identities were pathologized by the medical society. So what I experienced in my clinical practice, people would come in and their chief complaint would be, Doc, I have gender dysphoria. I was like, oh, what's that? When I started off, like, oh, you know a lot about gender dysphoria. So there is this notion that other healthcare providers, that they have to refer a transgender client first to a mental health professional before they can even offer a basic medical service. Okay? So basically, gender dysphoria is that discomfort or distress. No? People tend to refer to psychiatrists just because of this, but not all transgender people may experience this. I've met a very few transgender individuals who came to me and then their story went something like, Doc, I'm here today because I want to fully achieve my masculine traits. And when I asked, when did that start? Like, how did you come into terms with your gender identity? He started his story, his cuento, as early as 5 years old. His parents were very supportive. Whenever he was going to school, his parents already talked to their school to allow him to wear the uniform that he's more comfortable with, which is usually shorts or pants. He was not mandated to wear the prescribed uniform for women or females. So with the support that he had with his family, he grew up. He never thought that he had a problem with his gender identity and expression. It only came to realize that when he was entering college, and he was meeting a lot of people who were bringing up the issue now, oh, why are you wearing masculine clothes instead of like wearing skirts, blouse? Then that's the only time he realized now, oh, is there a problem with how I wear, how I express myself? Okay? So growing up, he didn't experience that discomfort only until recently. Okay? So those are quite the lucky ones, no? Who are fully accepted by their family, by their peers. Okay? So in terms of transgender health, I have to remind everyone that the most recent ICD has already redefined gender identity-related health as no longer a form of mental illness. So this has already been recategorized under conditions related to sexual health. What's the benefit of this? This basically shows that trans-related and gender-diverse identities are no longer conditions of mental ill health. It ensures access for the community for gender-affirming health care and health insurance coverage for such services. It's very expensive to pursue or to proceed with medical gender-affirming interventions, especially from my country. Hormones may range to around, let's say, $100 to $150 on a monthly basis for some, and what more for the surgical interventions. So this also acknowledges the links between gender identity, sexual behavior, exposure to violence, and sexually transmitted infections. So this is where HIV and STI medicine comes in. So I'd like to reiterate the statement issued more than a decade ago, that being a transgender person is a matter of diversity and not a pathology. It is very important to de-psychopathologize gender identities, as this is already a path to trans justice. Every trans individuals have their own personal journey that are unique to them. No? We cannot box people or stereotype them na all transgender women would like to pursue hormone therapy to feminize, that all transgender men would have to undergo certain surgeries for them to be trans. No? So I'd like to emphasize that there are no medical criteria to determine how trans a person should be. Okay? So let us not assume that a trans person's identity would always require medical transition. I do have clients come in to me, they just want to have somebody to talk to about their concerns, about how they felt, how their families are not supportive of their own identities or expressions. I also have parents who come in with their child or with their, no longer a child, adolescent or young adult, still children, yes. Their sons or daughters, they would come in and they just want someone to give them more insights about the journey that their children are going through. Okay? So they're not exactly always seeking medical interventions. So for a medical provider to assume that, that's already a form of pathologization. So how do we handle or how do we combat or how do we pursue de-psychopathologization? An easy way to do this would be upholding informed consent. So this is a model of care wherein we put at the center of care our clients. No? We highlight them. We put them on the spotlight. They're basically the drivers of their own health. Who else knows better how to keep themselves healthy? It's the individuals themselves. We as providers, we take the passenger seat. We hold the map, we give them guidance, where to go, what detours they can take, and what are the dead ends. So in terms of transgender health, and I think in general healthcare, by using the informed consent model, we basically ensure that we are partners in health rather than gatekeepers. We don't dictate how they should pursue their medical transitioning or how to take care of themselves. We put onto the table the risk, the benefits, let them review, let them reassess that, let them reflect on those. And then at the end of the day, they get to decide what options are they willing to take and what risks are they willing to take as well. So if usually they choose the high risk options, the least medically recommended options. So as a healthcare provider, my role would be to create other options. So we create more options. No? So we don't simply just tell them, oh no, you cannot do that. The moment you do that, the moment you say that to a client, their mindset would be, if I cannot get it in this facility, I might just go to another facility. Lucky for us if they will do that. But most of them will just simply, if I cannot get it from a medical provider, then I'll just simply do it on my own. I'll go rogue. Because the first medical consultation or the first clinic interaction, the experience that they will get, would set their health-seeking behavior. So the moment they feel discriminated, stigmatized, then they will definitely fall off from our medical supervision. So, with informed consent model, this seeks to acknowledge and better support the patient's right to and capability for personal autonomy in choosing health care options. A mental health assessment with a psychiatrist is not mandatory, but should you assess them to have mental health concerns, a referral to a mental health provider is warranted. But you still may proceed with gender affirmative care. It enables providers as well. So we have a benefit through this informed consent model that we attain a richer understanding of transgender and gender non-conforming clients and to deliver better patient care in general. So I also experienced that I had certain biases, prejudices. I did come from a medical institution that was I'm a product of a medical institution that's really a pontifical university. So it was really grounded on theology. But still, I was able to come into terms or come into peace with the certain concepts through this approach, informed consent. So for every trans individual, they would undergo a certain quote-unquote transition. No? It is commonly referred to as transition, but basically it's gender affirmation, which is the overall process by which individuals and communities are affirmed and respected in their gender identity. So this is usually a multi-dimensional principle. And the four core domains that usually a client would undergo would be personal, psychological, medical, and legal gender affirmations. This is not linear. This may be dynamic. One does not necessarily come over the other. No? Some clients the usual story that I would get is they would have this sense of questioning or sense of self-awareness that something is different from their peers, that they feel or they see themselves differently when they look in the mirror. Some would already feel that I'm no longer comfortable being called as Mr. or Miss or by my given name. So they would affirm themselves by, I would prefer to be called this. For example, my nephew, before we always call him Macho. His given name is Mateo, so our pet name for him is Macho. But when he started to grow up, he's already around 11, he started correcting us. I don't like to be called Macho anymore. I want to be called Mateo. So we acknowledge that. No? That may not be a gender identity related, no gender related concern, but we respect his chosen name, okay? How he wants to be addressed. Same goes for gender diverse people. And then most would come to us for medical gender affirmations. No? And then some would proceed to legal. Okay. So me as a primary care provider, this is basically my role. No? So again, I'm a general physician. I'm not an endocrinologist. No? But people come to me for gender affirmation because I focus on providing them, help them explore issues of their gender identity. So basically, it's more on counseling. I conduct initial assessment wherein I also assess them for other physical or mental health concerns. We discuss the pros and cons of the interventions that they want to pursue. And then I manage certain health issues. So if they are deemed to be, they're assessed to have comorbidities, right then and there, I would intervene. And then if it's beyond my service, I would make appropriate referrals. I don't simply say, oh, that's beyond me. You go find another doctor. I make sure I link them. So I reach out to colleagues, though that's also a challenge from the beginning. So you make appropriate referrals where they can get the appropriate care that they need. And then, of course, provide preventative care. This may not only about gender identity health issues, but also about STI prevention, HIV access interventions, vaccinations, etc. So for anyone who wants to start off their gender affirmative practice, I would recommend this module developed by the Asia Pacific Transgender Network. This is a good startup package or starter pack. No? It's basically accessible online. No? It discusses 12 different topics. It's a self-paced e-learning module. It has available PDF or a hard copy that you can also use. No? It's also developed into different languages. No? We're currently working on adapting this in our local context. So the beauty of this is that it's also a self-reflective module. No? You can finish this, like you can take a course, one topic, less than an hour per day. So in about 2 weeks, you'd be able to accomplish this. Or if you're like me, who likes to cram up everything, I finish this in less than 5 hours. No? Like Netflix binge watching. No? So I love binge watching. So this was easy for me to binge watch in less than 6 hours. Okay? You may scan the QR code save it in your bookmark, do it later, or before your flight, or during your long flight, or while resting at home. You may binge watch as well with me. No, so, yeah. Okay, so going back with Victoria, it started way back in 2016. It's a community-led service delivery model wherein we integrated gender affirmative care in our sexual health services. We were only offering HIV testing during that time in 2016. I came into Victoria around 2017, and I was offered the position of I provided the services pro bono as a volunteer, and that's when I learned that they don't have a clinical protocol yet at that time. So I helped them develop their own clinical protocol with how I can provide the services. No? So it was a work in progress. No, I didn't receive any guidance, a template on how to set up a transgender clinic at that time. So it was basically touch and go. Yeah. So the clinical protocols were evolving as we go along. No? For every client interaction, there was a new insight, then we incorporated it immediately in the process. So basically, we uphold patient autonomy through the informed consent model, and then we provide them not just counseling support. Some clients, we've learned that they are not able to pursue with their gender affirmation or medical interventions because they don't have work. They experience discrimination. They were not accepted in employment due to their gender identities. So we link them to redress mechanisms. No? We also refer some to agencies that can provide technical and vocational workshops. So we also work with other NGOs, trans NGOs, that would be able to help them in terms of social, economical, and psychological support. So it's very crucial to network. Then eventually, 2018, we had to accredit Victoria as a satellite HIV treatment hub to support the clinic operations and to further ramp up the HIV interventions for the key population at risk. Okay. Yeah. So aside from working on the clinic, I basically am more comfortable working in the clinic directly with clients, but as I learned, as Dr. Prafan also emphasized, that as a doctor, we also have to advocate, and if must, we have to be an activist to further promote what our clients need. So we help train more healthcare providers to be trans-sensitive, to provide gender-affirmative care. We also helped in the establishment of the Philippine Professional Association for Transgender Health, which was established in 2022. So I'm currently the secretary and in charge of membership. So I do also recruitment, because this is a time that as much as we are providing for the community, it's time for the healthcare providers to also be in the advocacy. So basically what I'm doing is pulling them together, making them share the common space and facilitate that conversation on how to improve healthcare services for trans people. So going back to the III experience, so we established safe spaces for transgender people. This can be done through communication. So if you notice, I started with introducing my pronouns. That might be a small thing, no? That's something that doesn't make a lot of sense. That was what I thought also when I started. But what I realized is the moment I share my pronouns, or the moment I introduce myself that way to a client, there's a certain sparkle in their eye that like, oh, you share your pronouns. It makes them feel that this is a space that I can share my identity freely without judgment. So it does not benefit us, but our clients, by merely sharing pronouns. Okay? That way they're more open. Oh, by the way, I consider myself as a trans woman. Can you call me Michelle? See? So it already opens up vulnerability, and it opens up the discussion. They are more comfortable sharing their concerns aside from what they initially seek. Some would just come in, I'm coming in for an HIV testing, that's it. but they're not willing to share their stories about their sexual risk behaviors because they might feel judged for their gender identity. So we may not be able to gather the necessary details or data that we need to provide them the care that they really seek or need. Okay. So by adding pronouns in all your staff name tags, business cards, email signatures, especially if there are online inquiries, this would also give that notion to the client. You must ask all patients. No? You don't simply share your pronouns to a specific group. No? So you share your pronouns, or you ask all clients regarding their chosen names or their gender details, and let other staff or trained staff on how to handle this sensitively. So basically, you're already establishing a safe space with that simple statement. So aside from that, you have to establish a physical safe environment. So our clinics, we do hire transgender people as our healthcare worker. So in Love Yourself, we only have one transgender woman doctor. And then we have, before we used to have a trans woman nurse, then we have trans women staff, either secretary, frontline, or front desk. So it already shows, it gives that visibility. Now, the moment a client steps into your facility, this is a space that I can be myself without judgment. Okay? Aside from that, so the forever debate, no? Whenever I'm invited for talks in companies, like the issue about bathroom. It's just a bathroom. Let people be comfortable in a bathroom. So you may use specific gender-neutral bathroom options, male, female, but also allow them to choose which facility would further make them feel comfortable. So instead of using the gender signs, you can just use the sign that has the urinal, which has a toilet. Okay. Similar to what Tangerine Clinic here in Bangkok has. Okay? And then in one hospital, I noticed in the Philippines, the one that I came from, they already have gender-neutral bathrooms in the hospital. So that's already a huge move for them, considering they're a Catholic facility. Okay? So aside from that, a digital platform. So how come people keep coming to Victoria? How come they know that this is a space for them to feel safe? You have to put in your campaigns. So visibility definitely matters. So campaigns are crucial. So that's why I think this is the strength of Love Yourself. We are able to generate demand, or we are able to reach out to the target population that we need. So through our campaigns. And of course, you have to show on your website what services do you offer. So we put right there trans health. It's what people know about. No, we don't simply put gender affirmative care. Some would ask, what's that? So they relate more with trans health. Then of course, we do engage with, for example, if we get invited to talk about transgender health in certain like Spotify, and influencers, TikTok. Yeah. Oh, this one. So in terms of record keeping, it's a bold move already by using a two-step gender assessment. I got invited for a partnership with a local surgical aesthetic clinic in Manila, and they were willing to have a collaboration, like a referral mechanism, wherein they're not really familiar on how to handle hormone therapy, but they do experience an influx of clients seeking gender affirmative surgeries. So they want to partner. And then on that day, they were asking like, can you teach us? Can you train us? When can we set a training, a workshop? Sabi ko, I told them right then and there, I can do it now. What do you need? What do you need? Can I see your client uptake form? Okay. So they showed me their client uptake form. And then right then and there, I told them, you need to change this part. This will already have a huge impact. When a client sees this in their form, they would feel, so I can freely declare my gender identity. So you simply put their sex assigned at birth, and their gender identity. I prefer the free writing, blank space, rather than a checkbox. Again, I don't like boxing people. I don't like stereotyping. So I prefer a free writing. You'll also gain insights like how they see themselves. The longest that I've seen there is a person identified as, I see myself as a non-conforming trans feminine. Then she put there a person because she's not yet fully affirmed about her female characteristics. So that's interesting. At first, I didn't understand that, but I asked her, what do you exactly mean by non-conforming trans feminine? I understand a lot of healthcare providers are overwhelmed by the different gender identity terminologies, but I assure you it's going to be easier if you just let your clients define who they are, just listen to their stories, and move forward with that. Yeah. Aside from that, make sure to document chosen names, pronouns, and make sure train your staff to address them in those details. And then something that I changed is about chief complaint. In terms of our medical history taking, we are so used to asking, oh, what's your chief complaint? Or how to go about their history of present illness. Again, gender identities is not an illness. They will come in not because of a pathology, but they would come in for a certain concern. So by changing that, that will also train your providers, to approach it in a de-psychopathologized way. Inaalagaan, so by providing client-centered, you have to be able to provide a trans-competent care. This can be done if you have achieved two crucial core competency. So first is a transclinical competency. This is what we're usually doing, through a demonstrated competency of healthcare needs, through either training, residency training, exchange of information, or during the symposiums. But what's hard to develop is the transcultural competency, wherein you have the ability to understand, communicate with, and effectively interact with the trans people that is free of stigma and discrimination. So you may consider yourself trans competent if you are able to demonstrate competency in medical provision free of stigma and discrimination. So there are certain trainings to help you with that, but again, I learn more directly from the clients. So every client interaction is a learning opportunity. What makes them feel comfortable, what makes them feel stigmatized. So I reflect on those at the end of the day. Yeah. So you will be considered a trans-affirmative care if your services are inclusive, self-determined, and rights-based. For them to feel that they are provided differentiated service delivery. So it's good to show them that you also have other health interventions. So they may come in for simply hormone therapy, but then they're gonna see, oh, you have mental health support. I would like to access that as well. Or I haven't been tested for HIV. Do you have HIV testing here? Okay. So it's good, again, visibility matters. And then in the Philippines, the direction for health services in general is that in 2018, it was already enacted as law, the Universal Health Care Act, wherein all Filipinos will be able to access a full range of health services. And this includes transgender people. This is to ensure that no one is left behind. So we've been working as well with the Health Ministry in developing clinical practice guidelines that may be adapted through the life course approach, that for every life stage of an individual, may they be gender non-conforming or transgender person, they would be able to access basic healthcare services. And of course, part of our role as well is for service mapping. Again, in terms of, like in my case, we're a community-based organization. We have very limited services. We are not a one-stop shop, but we do try to map out where we can refer our clients. So it's quite hard to simply refer, you go find your own endocrinologist. That may be harmful for a client, especially if they were able to go to a non-sensitive healthcare provider. Then they will also not follow up with you anymore. So this was an experience I This was an experience way back in my early practice, wherein I referred the client to a psychiatrist because the person needed mental health anxiolytics and to address major depression, but basically I lost him to follow up because he did not appreciate how the psychiatrist handled his first consultation. Only until after 2 years, he came back to me to give me an update na, Doc, I've already proceeded with my hormone therapy and I'm more happier now. No? I don't need the anxiolytics and I don't need the medications for the depression. So he gave me that feedback that referring him to a psychiatrist was more harmful for him. So it was a realization that until now I use in my practice. So for the next clients that I would encounter, I make sure that I be careful with the referrals. So I try to get to know the other colleagues and my colleagues who I'm referring to. So we've established Philippine Professional Association for Transgender Health in the Philippines. So currently we're still in the infancy stage, but we've done a lot of work for the first year, mostly about workshops, sensitizing other healthcare providers, getting members, and of course getting accreditation with different medical societies. In the Philippines, you have to be affiliated with a lot of medical societies, especially the specialties, for them to at least acknowledge you, no? Or to include, or we aim to include transgender health in medical school, education, in residency training. Then, moving forward or in the long track, so we also are open to partnerships, no, collaborations. So we do plan to roll out the first Southeast Asian transgender health cohort. This is led by IHRI and Treat Asia as well. So I just got this slide yesterday, so I was advised that I was already given the go signal that I can share this, but hopefully we're about to start, hopefully this year. If given a chance, we might be able to share our initial findings next year or in the subsequent years to come. Okay? So to wrap up my presentation again, so I hope I was able to address my agendas. The transgender health is a shared journey between provider and client. You may start small and it will eventually snowball. No, do not miss on those small things. Okay? And by reflecting on our own practice, on the information that we learn, we get to unlearn old biases. That way we can incorporate new concepts and embrace innovations. With that, thank you.